and then, um, so, thank you so much, Michelle, for joining us here on Zoom for an informative talk for our advocacy for caregivers of loved
Mhm.
ones with aggressive and self-injurious behaviors group.
Mhm.
My first question is how would you like to introduce yourself today?
Sure. Well, my name's Michelle Trivedi, and first and foremost, I'm a parent of a wonderful adult on the spectrum. She is just turned 24 years old over Labor Day weekend. We've been on this autism journey for a while and have a lot of lessons learned, and hindsight being 2020, lots of things that I would tell my younger self to not worry about or to maybe do differently. And then I'm also, I've been a health insurance advocate and health equity advocate for people with autism since 2000. I was part of the parent group that got the Indiana autism mandate passed back in 2000, which was the very first health reform law for autism coverage in the nation. And it opened the doors for autism health insurance coverage to be passed in some form now in all 50 states.
Wow.
So Indiana was a leader in that area, and my daughter was the test case to enforce that mandate and to make sure that the health insurers were abiding by the law as it was intended. And so that was a 6-year journey of fighting those cases. And since that time, and I also had the benefit of being a health administrator and a managed care contractor. So I knew the insurance world pretty well. And so I was able to fight those cases on behalf of my daughter and all the other kids in Indiana so that they could get their insurance coverage as the law intended. So since then, I've worked either as purely a volunteer, and now I work as a contractor for the ARC of Indiana to help families with all developmental disabilities with health insurance issues, and just to basically access the benefits that they need and to help them problem solve when they run into barriers. So that's what I've been doing with my life for the last 20 some odd years.
Wow. I actually got chills from that because one of the important things when I met Megan is Megan has such a strong passion for advocacy. And
Mhm.
it sounds like you have been part of a grassroots effort with parents to advocate for this. So it
Yes. I'm
can be
also part of
done.
a national network that works on advocacy across the nation as well. So, yeah, it can be done. Parents have really been the driving force behind a lot of disability rights and really have been the driving force behind health insurance coverage for autism and health equity for
Wow.
people with autism. So, yeah,
Wow.
when parents get together and, fight the good fight, we can get a lot of good things done. So.
Wow. Yeah. Um, are you comfortable sharing some of your personal experiences, your story a little bit, or how you got to where you are with your loved one?
Yeah, sure. My daughter has what is some people call regressive autism. So she started speaking at 10 months and started speaking in some simple full sentences. Around 18 months, had about a 900 word vocabulary. And she was my first child. So, of course, I kept track of all that because, it's your first baby and they're the one that's the baby that gets the really good baby book, with all the details in it. And then when she was about 20 months old, over the course of about a 10-day period, she had a major regression, lost most of her vocabulary. She started going like this and just being oddly preoccupied with her fingers, which of course I know now is self-stimulatory behavior, started screaming for everything she wanted instead of pointing like she used to. And it was scary. It was very scary. We didn't know why this was happening. And unfortunately, at the time, the knowledge about diagnosis was not as good. And also there was a myth that really only boys got autism. So it took a long time, unfortunately, to get her diagnosed. It took about 18 months to get her diagnosed. And it actually wasn't until we moved states and came here that we found a pediatrician who was willing to refer her for a diagnosis, because I went in with a piece of paper that I still have that says, this is why I think my daughter has autism, 1, 2, 3, 4, 5, 6. Because I'd done my own research, having the benefit of a background in healthcare, and having my husband's profession, his second profession, he's a physician. And so we did a ton of research together with reliable medical sources, and kind of already decided she had autism before she was actually diagnosed. So that was quite the journey. So it was a little unusual that I was actually relieved to get a diagnosis, because then I thought, well, great, now I can do something. I'm kind of a doer and a planner, so I wanted to do something. And at the time, what I was told was, go talk to other parents and see what they're doing. There was no treatment plan, there was no care plan. And so we kind of had to do it ourselves and figure out. So through research, we came to find behavioral treatment that was the most evidence-based practice. And so we engaged with the Lobos Institute for Early Intervention and started an ABA program with her when she was about 4 years old.
Wow.
Yeah. And yeah, so that's kind of where we started. And we did the kind of the typical early intervention. And it became clear that my daughter was not going to be a best case scenario type child who was going to move out of ABA somewhere in grade school and go to school full time without support. And then in puberty, it became really clear that we were going to have a lot of behavioral issues. There was biting and hitting and kicking when she was younger, but she was smaller. And so it was easier to intervene and easier to avoid. But she outgrew me at 11. You can't really tell on Zoom, but I'm 5 feet tall. So it was not going to take her long to outgrow me. And so puberty, I'm not going to sugarcoat it, was really, really difficult, the most difficult part of our lives. And there were a good day was 70 self-injurious behaviors or aggressions or property destructions. At the worst, my daughter put her head through a microwave door, which the company told me was impossible, but she did it. So it was definitely possible. And so that was, a really scary, really difficult time in our lives, because we were just really afraid that we wouldn't be able to keep her safe at home. And I was kind of the main target of her aggression, with biting and hitting and scratching at eyes and things like that. And so there was just a lot of concern for safety. And then, of course, a lot of concern about, I told my school, I will always be within 15 minutes of school. Do not call the police. Do not call the police on her ever, please, and had that written into her IEP, because I didn't want her disability to become a crime and to have her engaged in a system that should never have to be treatment for someone with autism, and should not be the only solution for people with autism who have severe behaviors. So, I had to quit any kind of career, or, to be able to stay home with her and be that available, which I'm so blessed that I was able to do. Not every family has that option. So I feel very blessed that I did and still do, and that my employer, the ARC, is so incredibly flexible. There was one time when she was, having really, really severe behavior issues. And I just said, I can't work this month. I just don't know day to day what's going to happen. And they said, fine. Just call us back when you're ready to go. So again, such a luxury, because I can't think of any other employer that is that flexible and that understanding of disability issues. So, because I've been so blessed with my situation, I really want to be a resource and a help to other families who don't have access to all of those resources, and to just try and make the road a little bit easier, because it shouldn't be this hard, but it is. And, we have to acknowledge that and then do what we can to address it and make it better.
Yeah. Yeah.
I have just a couple of questions. So you can actually have it written in the IEP not to call police?
I did. I did in terms of having, as part of her behavior intervention plan via her IEP, is that, here were the steps we were going to take. And calling the police was not on the list. And I, made myself available to make sure that that was truly an absolute last resort, not something that was going to be a go-to. And also, sending her home. No, that's not acceptable. That is not a reason to send her home. We need to have a behavior intervention plan to work through the behaviors, to help prevent the behaviors. Sending her home just teaches her, if I have a behavior, I get to go home. So, those really specific things we had written into her IEP that, no, we were not going to send her home over behaviors. We were going to have mom come in and help, or we were going to have her board certified behavior analyst on the phone to consult and things like that.
Yeah.
That did take due process to make happen, to allow the behavioral, the BCBA, the board certified behavior analyst, to do on-site consultation. That came from a due process settlement that we did when she was in grade school.
Was she, when she was having these aggressions and everything, was she in ABA or school or both?
She was in both. My approach, my husband and I, the approach that we took from the beginning was that we wanted her to be in school and in ABA because she's an only child. And so it's very hard to teach social interaction with neurotypical children, or even with peers of all levels of ability, without having access to peers of all levels of ability. So we wanted to make sure that she was in school so that she would have access to peers on a daily basis of various levels of ability, so that she would learn to be able to function in challenging environments that we can't control. We can control our home, but we can't control a movie theater or a restaurant or, Lowe's or Target. So we wanted her to really learn how to be able to function in various environments and with all different kinds of people. So.
And how exactly, I know this isn't necessarily a topic. I know talking with the Autism Society, like a lot of people are having issues getting that BCBA to talk to the school. Like, is there kind of a short way you can kind of say?
Oh gosh, I wish there was a short way to make that happen. Well, we live in a local control, school board, local control state. And so unfortunately, it's really district by district and even school by school negotiation. Because of redistricting, my daughter was in 3 different schools in grade school. So it was renegotiation every time with each building and each principal, and to make that happen and to make that be effective. Also, the ABA provider that we've used, both the Lovas Institute and Little Star, both were had a very good philosophy about working with the school, and really worked with the school in a collaborative and partnership vein, not in the vein of, I'm the autism expert and I'm going to tell you everything you're doing wrong. Everybody loves to hear that. So, so they had a really good philosophy of working with schools as partners and as support versus, coming at it from a different direction. So once we were able to get through the due process piece of it, it did become easier, but it was constantly an ongoing negotiation. And quite frankly, the teachers and the aides really appreciated the support and the help. It was more getting the administrators on board with the outside assistance, but also because my daughter's ABA is health insurance covered and is medically necessary. Schools are required to accommodate a person's medical care, and schools are required to accommodate, reasonably accommodate half days to go into ABA therapy, or leaving early or coming in late to go to ABA therapy, because it's like a doctor's appointment, or it's like a child going through chemotherapy or a child going through some other kind of intensive outpatient treatment that requires them to miss school. So that's a requirement for schools to accommodate that. And so that can be written into the IEP as well, is that there is this medical accommodation for the child to go to school with some kind of alternate schedule that isn't the typical school hours necessarily. So she did half days for a long time, and then would leave at 1 o'clock. And then she eventually got to full days, and then would do her ABA therapy after school and on Saturdays. But that wasn't until she was in high school. So she was on half days for quite some time. I'm starting to think I need to write a book about her life and all the different battles we fought.
Yeah, I was just like, I have a similar situation with my daughter, and she actually wasn't able to stay in her home school. She had to go to a special needs school because of the behaviors and everything. So I'm kind of shocked.
Yeah. And a couple questions I have is, because I keep thinking of how much parents have to remember and have to research and have to look at. I'm thinking, okay, once kids start school, can they have a checklist for all of this stuff to do? Because, and so did you use InSource at all to find this information, or did you have like a IEP advocate to help you with the school component, or did you just do the research yourself? I'm curious.
Yeah, I did consult with InSource on a couple things, and then I also went to what's called rights law training. It was in person. I'm old, and so it was in person and wasn't an online training at the time. I think it was a 3-day training. It was the best education IEP based training that I'd ever done, and came with books and resources and worksheets and things like that. With it. And of course, they have a website now and online trainings now that parents can kind of do on demand, is my understanding, and can get information about their rights and some strategies from that as well. And so that was really helpful. And then a lot of it was strategizing, my husband and I, about, my husband being a physician and me working in healthcare. We knew some of the rights that people have to access their healthcare within the context of the school system. And so, kind of fighting those battles, we were equipped to know that, under the ADA, this is required. And I've also done a lot of training through the Autism Legal Resource Center and through the Autism Law Summit to get information about what ADA requires specifically to autism, and different legal trainings, based on how the law affects people with autism specifically. So I'm not a lawyer, but I've really been able to access a lot of really good training from really good lawyers who do special education law, ADA law, and autism law specifically. Dan Unum and Laura Unum, for example, wrote a textbook on how the law affects people with autism in various ways. And they're two of the main resources that I use. And Lori Unum runs the Autism Law Summit. Dan Unum runs the Autism Legal Resource Center, and I'm on the board of the Autism Legal Resource Center. So they've been tremendous resources for me professionally and personally to get information. And they're the Autism Law Summit website and the Autism Legal Resource Center website have good information. And the Autism Legal Resource Center does parent trainings. I'm actually doing a series of parent trainings with them, as well as other folks and lawyers are doing them as well. And so that's been a great resource as well, so that I can kind of know what my daughter's rights are and then effectively advocate for them. But yeah, my husband and I used to joke, it's like, we didn't know we had to go to medical school and law school and just to raise a child with autism successfully. So,
Yeah, it sounds like you're in a great position to help others right now.
yes, and again, that's because I've been blessed with a really good situation with my family and with my job and with my husband's job. And so, just like the parents before me who founded the ARC, and the parents before me who fought for IDEA, and the parents before me who fought for the ADA, we just pay it forward and help other parents and just try to make things better for our loved ones and for future one.
I do have a logistical note. I'm hoping it worked. I tried to upgrade right now to the time, but if not, could we all just open the same
Rejoin.
link and start
Yeah.
it
Oh,
again,
sure.
just in
Yeah.
case. I'm
Yeah,
so
I did
sorry.
notice I see a time left. So yeah, that's totally fine.
Yes, thank you, and
Yeah.
I apologize about that.
Oh gosh, no worries.
Yeah. So I do have a question to you, if you're comfortable sharing again. So how do you feel where you're at now with the medical, the school, with your daughter now? Like, how do you feel like you shared that you've on your email that the behaviors have minimized?
Mhm.
Where would you say right now you feel like you're at now, and what your hopes are for the future?
I would say right now, my daughter is doing things that I would never have predicted at 12, 13, 14, 15, 16, when she was having just such incredible challenges. I would have never guessed she was doing them. She's doing a day program and, following her group and really enjoying herself. She's very social. We go to concerts, we go on trips. We go to restaurants. I mean, we have a pretty, it's a new normal, but we enjoy ourselves. We enjoy our family. We enjoy her. She's happy. And so we're in a really good place. Does she still have challenges? Oh, yes. Is she going to live independently? Oh no, she's not. We're going to be the Three Musketeers or the Three Amigos, as we call ourselves, the Three Musketeers or the Three Amigos. We're going to be that for life. But we really enjoy each other, and life is a lot easier. We did a lot of hard work to get here via ABA and training for both myself and my husband and caregivers. And, there were a lot of things that through puberty and whatnot that we missed, a lot of family things we missed, a lot of things we couldn't do. But to come out on the other side of those behaviors and be able to enjoy our family life the way that we do, the way that it's, quote unquote, normal for us is wonderful. So it's been a good journey. It's been a tough journey, but to see her now and see how happy she is and enjoying her activities, and just, as she says, being a fierce and independent woman who's living her beautiful life. That's really, really cool to see.
Yeah, that's awesome.
Yeah.
So how did you get through like the difficult times?
Humor. Humor, and my dogs and friends, and just knowing that we were doing the best that we could with what we had. And of course, the support of the ABA therapy program that we had was really tremendous. At one point, they were here in our home every waking hour of the day for behavioral support and to keep everybody safe. And so that was really amazing. And they worked really hard to get her insurance to cover that, and which was spectacular.
Mm-hmm. Megan, do you have a follow-up with that? Because I was going to ask about the insurance and how does Medicaid help with all of this? Like, first of all, the private insurance component, and then how does Medicaid help? Like, what can you use the CIH waiver and the Medicaid for to help with all of this?
Sure. Well, Thanks to a lot of parent advocacy across the country, all 50 states have some sort of health insurance mandate for autism. And because of the Affordable Care Act, most health insurance plans also have to follow what's called federal mental health parity law. And regardless of how you kind of want to label what autism is, for purposes of health insurance and federal mental health parity law, unless autism is specifically carved out in a state, it falls under federal mental health parity law. And that's just kind of like a really short synopsis of a whole hour presentation that I give on mental health parity. But so most insurance companies in some way or shape or form have to cover autism treatment, but they don't always necessarily understand that and do it correctly. So that's where appeals and all of that kind of come into play. But because of the Affordable Care Act, our loved ones have a lot more protection in terms of asserting the right to get ABA therapy at any age. There are a lot of states that still have on the books laws that restrict ABA to certain ages. Our state does not. Indiana has always had no age limit on their mandate. Medicaid currently covers ABA therapy for people under age 21. But that has recently been challenged, and there was a successful lawsuit against the state that is being appealed. So we have to see how that turns out, addressing that it violates the ADA by having that age cap on all ABA services. They certainly could have different criteria for covering ABA for adults, but to have absolutely no access for adults was ruled as a violation of ADA. The Americans with Disabilities Act. So I was successful in getting my daughter covered under Medicaid for whatever her private insurance is not covering right now. So it is possible to get adult coverage right now while that's still going through appeals. And, you know, we'll just kind of keep staying tuned to how that is moving through the court system and where we land with that. But ABA is covered under Medicaid health plan. And so the health insurance side of Medicaid that people with disabilities get with their waivers. So it's distinguished from behavioral consultation that's covered under the waivers.
Okay.
Yeah. As ABA therapy has the layers of treatment. So they have the board certified behavior analyst, or a PhD or a BCBAD who oversees the programs. And then they have the registered behavior technicians who actually work with the individual one-on-one or in small groups to implement the programs. Whereas behavioral consultation will have a behavioral consultant who may work with the individual directly or work with the family directly, but they don't have the RBT component where there's a staff coming in and working directly with the individual, and it's not the intensity of service that the medical treatment is.
Right.
Yeah.
Okay.
And that was a really simplistic, again, a simplistic explanation of something that usually takes about an hour to explain.
Right, right. But that's I appreciate the simplistic explanation, because holy smokes, there's a lot.
There's a lot.
Do you want to exit out and come back? Because it says less than a minute.
Oh, yes. Okay, so I'm going to stop the recording and then I'm going to